Thank you for inviting me to be involved with this year's Go Red for Women event. I'm very honored to be representing Faith Regional. My name is Dr. Allie McCabe. I am a hospital medicine physician here in Norfolk. Actually, my background is that I did my training in family medicine, so I'm board certified in family medicine, which means my training looked very typical to what you'd think of a general practitioner. I did clinic, I covered rural care, adults, pediatrics, a little bit of obstetrics. But now my current position is a hospitalist. Some people might not be familiar with the term or the position hospitalist, so I just briefly want to tell you what I do. I'm a physician that just only takes care of hospitalized patients. So no clinic, no ER, just hospital care. So the older model of primary care physician caring for their patient in the clinic, and then if they become ill enough, also caring for them in the hospital, is just not quite as common anymore, especially in bigger communities. So my role is I take care of the patient when they're in the hospital, and after their hospital stay, I hand them back to their primary care provider for their outpatient clinic visits. So I think how my job directly correlates with the platform of Go Red for Women is that I take care of a lot of patients with heart and vascular conditions in the hospital, whether that's patients with an active heart attack, heart failure, arrhythmias, or stroke, vascular conditions. I'm very fortunate that I have great cardiology colleagues and neurology colleagues to help take care of these patients as well. But going back to the roots of primary care, patients should be encouraged to see their primary care providers at least on an annual basis for many different reasons. I think that the aspect of primary care encompasses preventative medicine. One category is preventative medicine, so preventing illness or chronic medical conditions. That would be things like getting your weight and height checked and your BMI to screen for obesity, having a blood pressure check to look for any signs of high blood pressure, getting routine labs to look for high cholesterol, discussing other symptoms you may have. So in conjunction with primary care or preventative medicine is also the management of chronic medical conditions. So if you are diagnosed with obesity, discussing with your provider about healthy weight loss, healthy diet. If you're diagnosed with high blood pressure, getting put on appropriate medications to treat that, to decrease your risk of stroke or heart disease, as well as being screened for diabetes or high cholesterol. And if those conditions are present, making sure that you're put on the right path for success to treat those risk factors for heart disease or stroke. Additionally, women with heart disease don't always have the same symptoms as men. They may not have that, wow, I'm having crushing chest pain kind of scenario with an underlying heart condition. Instead, being cognizant about other kind of symptoms such as decreased exercise intolerance, easily being fatigued or winded with minimal, activity, increased fatigue, pain in their jaw or their neck or their shoulders that just doesn't seem quite right, and bringing forward those symptoms with their primary care provider at those clinic visits. My position as a hospitalist, here we are on a virtual event because of the COVID pandemic. I have to at least briefly speak about COVID, as I see the sickest of the sick when it comes to coronavirus and those patients being hospitalized. This virus can and does create severe illness for patients. So I just want to encourage everyone as the fall and winter months are coming ahead and cold and flu season's coming as well, to be diligent about wearing your mask, keeping social distancing from others, we get into a tricky situation that I feel like with the weather getting colder, people are, forced indoors for any kind of sporting event or any event in general. And I just encourage you to think twice about going to those kind of gatherings. Um, my fears, if I'm being honest with you, about the upcoming months is that the hospitals may get to capacity. And, all the other illnesses that I care for in the hospital that are GI bleeds, infections, strokes, heart disease, those things don't go away just because COVID's here. So, um, you know, think about the healthcare heroes. Uh, I can't thank my nurses that I work with and respiratory therapists, physical therapists, occupational therapists. I can't thank them enough for everything they do walking into COVID rooms every day. Um, just please be safe and please be kind during these upcoming months. I think I do have a cheat sheet here with a few topics that I just wanted to make sure to hit on today. Um, you know, heart health, women's health, a lot of that does come back to fitness and an appropriate body weight. I'm very passionate about fitness. It's something I really enjoy. I feel blessed to be able to exercise and do physical activity. It also helps keep me grounded and a little bit emotionally sane during hard work stretches. So I could say a lot about fitness, but I'll just leave a couple of tips. I have two. One is I like to start every month fresh. So, like the night before the next month begins, I always hop onto my computer at home and I print a calendar, just a piece of paper that has the month of October. And I print that and I put it on my kitchen counter and I write just like really small little goals in the corner. And then I encourage you all to do this. This paper just serves as a daily reminder where I can write down like, oh, I ran 20 minutes today. It's just like an extra way to be present and actually feel good about the physical activity you do. So print yourself a calendar and start every month fresh. And then my other tip about fitness is that I like to do something called a no matter what movement, which is like no matter what, every day I have to do this movement. And I keep it very small and simple, but it's a good way to, get the body moving. Some of my examples are, I've been trying to do this pretty consistently since the summertime. 1 month I did every day 5 minutes of yoga and meditation. So really just stretching on the floor in front of my bed before bedtime. But no matter what, I did it. And another month, I had some workout friends that had encouraged, like we all do daily burpees. And then, there's a aspect of accountability when you can check in with those people through a text message, like, hey, did you do this today? So in regards to heart health and maintaining a healthy weight, those are just a few small tips and things that I do. Just, my final piece here would be, all of us women should be empowering and encouraging each other all the time. Thank you again for letting me be involved. Please consider donating or being involved with Go Red for Women. And watch me stay healthy. Watch me go red. Thank you.